Hi there, this is Malcolm Atherton with the Salesforce Marketing Cloud Healthcare and Life Sciences team. Today we'd like to introduce you to Maria and her journey with Makana Health, our fictitious healthcare provider brand, so that we can illustrate the journey that a patient like Maria can have with your brand as well, from advocacy all the way back to getting started at acquisition. Here we go. Let's meet Maria. Maria is 50 years old and she's the mother of two, and she's the primary caretaker for her elderly parents. Maria wants to take care of her family and her own health. Over her lifetime, she's had many interactions with healthcare, from having a broken ankle at age 21 to having her first and second children at ages 25 and 27, having her first mammogram and screening at age 40, and at age 45, she notices high blood pressure during a physical, something that she shared with her oldest daughter, Rachel. Now, it's important to note that there are some different phases that we'd like to look at here. We have before the journey begins, which is where we are right now, during, and after. We can also look at this as the time before you begin a journey with your patients as being an important information collecting time, or know me. During is how can you inform your patients of how they can become more healthy and how they should become more involved with your brand. And then after, what information and events and other things can you give or provide to your patients to empower them? We're going to touch base on all of those things here over the next few minutes. But first, let's talk about Makana Health. The Makana Health is an award-winning leader in providing convenient access to exceptional healthcare services where and when patients need them. And they really made a big effort this year to take those efforts to their digital marketing. They want to treat each patient like an individual and continue the wonderful on-site and physical experiences that their patients have with the brand into the digital side by providing them with one-to-one, right time, right channel, right information experiences for every single patient and patient to be. Here's Maria, and she's checking things out on her Facebook page, and she sees some ads mentioning the fact that it's currently Heart Disease Awareness Month. Makana Health has several online campaigns to promote this, as well as a healthy lifestyle assessment on their website for self-assessment of risk factors for heart disease. On several occasions, Maria has noticed these ads on her Facebook timeline and saw that they were sponsored by Makana Health. She's clicked through a few times, but she hasn't taken any action because she doesn't want to deal with any potential decisions that she might have to make if she has a negative self-assessment. However, today, Rachel, her oldest daughter, has reached out saying that she really wants her mom to get checked out to make sure that she's not at risk for anything. So she included the link to the online assessment that she can take to help get her started down that path to wellness, and she reluctantly agrees to go forward with the assessment. Maria clicks on that link, and she's taken to the Makana Health website, where she begins to fill out the assessment, as a guest, of course, and provide some basic information about herself, including name and email address. Now she's no longer anonymous. She fills out some other information about herself, but she suddenly gets a phone call, and unfortunately, she does not complete the entire assessment. The next day, however, Maria receives a gentle reminder email from Makana Health reminding her to complete her Makana Healthy Lifestyle Assessment, which she does. She follows the link and she completes the rest of the Healthy Lifestyle Assessment. She receives an email thanking her for completing the program and notifies her of the fact that she'll be able to see her results within 24 hours. The next day, a triggered email is sent to her, thanking her again for taking the assessment, but also informing her that her results are ready in the Makana Health portal. However, before she's allowed to see her individual results, she has to complete her member profile in order to see those results. So she does so. She provides some additional information so that Makana Health knows a little bit more about her, where she is, what her lifestyle is like, and then she's able to actually go through and see her results. Now, as she suspected, She does still have high blood pressure, and that does put her at risk. So there is a call to action to schedule an appointment with Makana Health, and she clicks to do so. Based on the location and demographic information that she provided in her profile, Makana Health recommends the closest office location. She selects a time, and she schedules her appointment. Maria also opts in for appointment reminders via SMS, email newsletters, and information about upcoming events from Makana Health. In that same email, where her appointment is confirmed, she also sees an ad in that email notifying her that there is an app that she could download. So she does, and she opts in for push messages. Over the course of the next couple weeks before her appointment, Maria receives a series of messages from Makana Health getting her ready for her appointment, as well as personalized lifestyle and healthy living content based on her profile. She thinks this is really cool because the information that she's receiving is tailor-made for her and her risks. Maria receives an SMS message reminding her of her appointment at Makana Health today. This is very handy. So, on her way to the appointment, as she nears the location where her appointment is going to take place, she receives a geo-targeted welcome push message from Makana Health with directions to the suite number and the reception desk. That is super helpful. Maria has her appointment and she receives specific next steps from the doctor. She leaves reassured and glad that she heeded to her daughter's suggestion and took that first step. Maria texts her daughter Rachel to share her experience and confirms their plans to have dinner as a family later that evening. Rachel is excited. Maria is excited. In the time after her appointment, Maria receives a variety of messages from Makana Health, including both preventative health and wellness information, browsing data, profile information, as well as a follow-up from her previous appointment. As a way to track and manage her fitness and wellness goals, she decides to connect her Fitbit profile to the Makana Health app, and her exercise logs are synced with her medical logs, blood pressure, heart rate, etc. Helps her medical team. A month later, Maria receives an email promotion for an upcoming event sponsored by Makana Health. It's a heart walk. Excited to get in more steps on her Fitbit and work towards her fitness goals, she forwards the email and registration link to her daughter, proposing that they sign up for the event as a family. A few months later, it's the Makana Health Walk, and Maria, Rachel, and the entire family participates in the event. As she finishes her walk, Maria's Fitbit lights up, letting her know that she's met her fitness goal for the day, and has even earned another badge. She gets a push notification from the Makana Health app as well, congratulating her on her dedication to exercise this weekend. The next day, Maria receives an SMS message reminding her that she can enter her bib number and see photos taken during the race and the day of the event. Maria checks out that event page and finds a great picture of her and her granddaughter from the landing page. She's able to share the picture to her social media accounts at mentioning the event and Makana Health. So over the course of the last several minutes, we've been able to see the type of journey that Maria's had with Makana Health. This is the same type of journey that we can help drive with your brand through use of the Salesforce Marketing Cloud. From acquisition, we used very targeted advertising in order to drive awareness and get Maria, in this case, into Makana Health's database. We were able to start driving her in towards an assessment and then an appointment. We were able to use the information that we captured to deliver information to Maria that was useful to her via email and SMS, not only about checking out results of her assessment, but also getting one-to-one recommendations on what she can do to help keep herself away from being at risk. And this relationship that Maria began to have with the Makana Health brand got her to the point where she now was using some of her valuable time to participate in Makana Health events and also becoming an advocate and sharing information about the event and mentioning the brand in a Facebook post. We'd love to be able to have a conversation with you about what patient journey, patient acquisition, patient advocacy means to you and where we can help. Thank you very much for your time.